There's a lot to know and learn as you begin your time as a program director. As program director, you're the leader of the facility and the buck stops with you in terms of maintaining quality and compliance. Your staff will look to you for guidance on a number of topics, and you'll be accountable to regulatory bodies for information and reporting. The following information will help you further understand your role. Record keeping is an essential function of your role as program director to demonstrate licensing compliance. Both children and staff records need to be maintained for DSS. You can document these records in whatever format you choose, handwritten ledger, spreadsheet, word processing document, but you must keep the information on site and handy for the Department of Social Services to review upon request. For licensing purposes, you'll need to gather the following information from your staff members before they can care for children. An employment application with identifying information such as name, age, address, telephone, education, and work experience, the date their employment started and, if applicable, the date employment is terminated, documentation of 3 non-related references. These are individuals who can speak to the applicant's knowledge, skill, and abilities. Even though an employee may not have listed previous employers as a reference, you should consider contacting them anyway to get an idea of their work performance. A signed statement acknowledging responsibility to report suspected child abuse or neglect, documentation of a background screening. You can find a short video on this topic on the DSS website. Please note, within 90 days of hire, a new staff member must complete orientation. As with staff records, child enrollment records need to be maintained for all children currently enrolled in the program and available for review upon request by DSS representatives. Preserve the records for 6 months after a child's enrollment is ended. These must include the child's name and identifying information such as date of birth, date of enrollment, date enrollment is terminated when applicable, name and contact information of child's parent or guardian, name of an emergency contact person other than the parent or guardian, a signed authorization from the child's parent or guardian for the program to obtain emergency medical care for the child's current immunization record, and a written plan, where applicable, for known food and other allergies. One final note about records. The old saying goes, with great power comes great responsibility. So make sure your staff members understand that sharing family information in conversation, on social media, in email, etc. with any person who does not have a work-related need to know the information is a breach of confidentiality. All licensed programs are required to have an emergency preparedness plan. The following components are required to be included: procedures for evacuation, relocations, shelter in place, lockdown, communication of plan, reunification with families, continuity of operations, accommodations of infants and toddlers, children with disabilities, and children with chronic medical conditions, staff training and practice drills. Refer to the licensing handbook, which is available on the DSS website for complete details and sample plans. All families in South Dakota should have access to supportive child care environments. That's why expulsion, the removal of a child from the care setting, should be a matter of last resort. The Early Childhood Enrichment Program can provide you with guidance and interventions to support the needs of all children. You're strongly encouraged to establish and communicate policies that limit expulsion, exclusion, or other exclusionary discipline processes. Supervision of children. It's the central purpose of a licensed child care program. It's about more than providing safety. You're responsible for helping the children in your care develop in healthy ways. That means accounting for all children in care. You can accomplish this by having staff in all areas of the environment and within seeing and hearing distance of children. We all know that children can get into trouble quickly. They're danger magnets, risk takers, and learning about what's safe and what's not is a lifelong process. That's why supervising staff members must be able to see and hear the children they're caring for. As child care providers, you and your staff have a unique responsibility to ensure the health and safety of all children in your care. Sometimes events happen that require you to report them to the proper authorities. These events include suspicion of child abuse or neglect, a change in the space used for care, infectious disease, an injury requiring medical attention, or the death of a child in your care. You can find full details and information about required reporting in the licensing handbook, which is available on the DSS website. As a director, you provide a vital service to the state of South Dakota and its families. Thank you for your time and attention. If you have any questions, contact the Department of Social Services, your regional licensing specialist, or refer to the downloadable handbook available at the DSS website.